Hello students. So in this class we are going to see about supraglottic airways, individual devices. Supraglottic airways are nothing but laryngeal mask airways. So in the previous class, in the part 1 video, we saw about the LMA insertion, classification, uses, the difference between endotracheal tube, all those things we saw in the previous slides. In this class we are going to see about individual airway devices. In NEETPG in the previous years, picture question, mostly they are concentrating on LMAs. So they will put a picture of LMA, they will ask you to identify which type of LMA it belongs to. Most often they ask very simple questions. But in this class I have given almost all the LMAs that have been used in anesthesia practice, and I mention only the salient points. So usually they just ask you to identify the devices, but they may go in detail in the upcoming years. So you just remember the salient points. I will make sure that you understand by the end of this class. Okay, so this is the most common LMA used. This is called as LMA Classic. So you just see the picture. This is the picture of the LMA Classic. So it consists of a shaft. That shaft is nothing but an airway tube. So this shaft is attached to a cup. So that cup contains cuff. So the cup along with the cuff is called as laryngeal mask. This cuff can be inflated by this pilot balloon. So this blue color cuff and balloon system is called as pilot balloon. So it can be used to inflate this cuff. So basically this is the structure of LMA Classic. So we'll see the salient points. So LMA Classic, it was first introduced in United Kingdom in 1988. So we saw the person who invented LMA, who is Archie Brain. And in United States it took some 4 years to accept the LMA. So United States started using LMA by 1992. We started using LMA very much later. Nowadays the LMA is very commonly used. So it consists of a curved tube that is called a shaft, which is connected to an elliptical spoon shaped mask at 30-degree angle. So there are two flexible vertical bars to prevent the tube from being obstructed by the epiglottis. So in front of the laryngeal mask airway, that is the cup, in front of the cup, we have two vertical bars. And the function of these two vertical bars is it prevents the epiglottis from falling on the opening of the tube. So that it will obstruct, right? So epiglottis should be kept away from the opening. So that is why the epiglottis elevating bars, those two vertical bars are called as epiglottis elevating bars. And it consists of an inflatable cuff, an inflation tube, and a sealing pilot balloon. That's it. So now benefits we already know. It is better than a face mask. It keeps the anesthetist hand free, and rapid and blind insertion. There is no laryngoscopy is needed, and very minimal training is needed. Can be used outside the hospital. Can be used for arrest situation. Can be used for difficult airway situation. Everything we saw in the previous slide itself. Now limitations. Limitations also we know. Control ventilation we cannot use LMA because the leak pressure is very low. That is, the leak pressure is only 20 centimeter of water. It will lead to aspiration. So that is the limitation. Now size and number of LMA. So there are actually classic LMA. There are 8 different types of LMA. So size 1, 1.5, 2, 2.5, 3, 4, 5, 6. So normally we use 3 and 4 size LMA. In Indian adult females, we use size 3. So here it is given the patient weight is 30 to 50 kg. But for Indian standards, size 3 itself is enough for all our females. And Indian standard size 4 is enough for adult males. And neonate you can remember less than 5 kg size 1, 5 to 10 kg size 1.5, 10 to 20 size 2, and 20 to 30 size 2.5. So these things you just remember, no need to mug it up. And the cuff volume also, if you can't remember, it is good, otherwise no problem. Now this is LMA unique. See, this is exactly the same as laryngeal classic LMA. So but one thing is, classic LMA, it is made up, it can be reused. It can be reused up to 20 times. It can be autoclaved and reused. But here the LMA unique is made up of polyvinyl chloride, that is PVC, and it cannot be reused. This is the only difference. Otherwise everything else is same. Now we will see some points regarding LMA unique. So it is a disposable LMA made up of PVC, that we already know. Dimensions are same of classic LMA. So the tube is stiffer and cuff is less compliant. So this is important. Because the tube is stiff and cuff is less compliant, we need to soak it in a hot water before using this LMA. So that will make the LMA unique more pliable. So that is the only reason for soaking it in hot water. It is more difficult to insert, but increase in cuff pressure is less with the use of nitrous oxide. See, one concept you should know, that is nitrous oxide is a volatile anesthetic we use for maintaining anesthesia. So this volatile anesthetics it is highly diffusible. It is very light and highly diffusible. So it can cross into the cuff, whether it is endotracheal tube cuff or it is laryngeal mask airway to laryngeal mask airway cuff. So this diffusing nitrous oxide will increase the pressure inside the cuff, but LMA unique restrict the diffusion. So it is one advantage is it restricts the diffusion, and it reduces the pressure inside the cuff. Now this is LMA flexible. So LMA flexible is almost same as that of LMA classic, but the only difference is it is the tubing, the shaft of the LMA flexible is armored. Armored means there is a it is lined on the inside by metal rings. So it cannot be compressed, it can be easily bent, and it can be changed to any shape. Normally in a patients who are inserted LMA, the anesthetist won't allow the head to be turned either side, because when they turn the head to either left or right side, the LMA position may change. So the way we might lose the airway during the intraoperative period. We may not be able to oxygenate the patient. We may not be able to ventilate the patient during intraoperative period. So normally we don't allow the surgeon to move the head here and there. But when we use LMA flexible, this tube can be bent to any shape without much changes to the laryngeal mask. So this can be used in head and neck surgeries also. That is the only advantage. So LMA flexible. So wire reinforced or reinforced LMA. So inside there is a wire which is reinforced. So it prevents kinking. We cannot easily compress it. So it can be bent to any angle without kinking. That is the advantage. It is less likely to be displaced during head rotation, whatever I told you. And uses head and neck surgeries in upper torso, surgeries in the chest also, like say lipoma excision in the shoulder, or fibroadenoma excision in females. And insertion here is a little bit difficult because these LMAs are very flexible, and we may need a stillet. We have to put a stillet inside the LMA and then insert. So that is the only disadvantage. So far we have seen three LMAs: LMA classic, LMA unique, and LMA flexible. All these three LMAs may look alike, but LMA classic you have to differentiate with the color. LMA unique, it is made up of PVC, you can see and identify. LMA flexible, we have to see the armor tube, and the shaft will be bent. So this is the difference. Now this is very important. I'm expecting this question may come in the future. So intubating LMA. So we saw in the previous class itself, one of the advantages of LMA is it can be used as a conduit for intubation. So this is one of the LMA which can be used for intubation. So it comes with a prefixed endotracheal tube. So already there is an endotracheal tube comes along with this set of the LMA, and we also have a stillet for the endotracheal tube, initial insertion of the so if you see these three structures, so a curved LMA like this, and a handle along with that, and endotracheal tube, and a stillet. If you see all these things, you just blindly write it, the name is intubating LMA, because this LMA is used to intubate. Now it is also called as fast track LMA. So sometimes they may given this picture, and in the choice you may see something called as fast track LMA. So fast track and intubating LMA are same. Only the company which got the which started producing, that is the name fast track. So recommended in both difficult airway situations and resuscitation algorithm. So both scenarios it can be used. So it is very useful. It is very costly, so that's why most of the hospitals they don't afford it. So allows intubation with minimal head and neck manipulations. So it is helpful in cervical injuries. So you don't need to extend the head, you don't need to flex the head. So it can be you can easily intubate the patient. And uses this tracheal intubation, blind intubation. That's it. Problems. So since it is a bigger LMA, so any pharyngeal pathology, LMA fast track is expensive, as I told you already, and the smallest size is size 3, which is for 30 kg patient. So below this we cannot use this LMA. We can use this LMA only in adolescent people and adults, not children's. So can be done. So this is a disadvantage. So there is something called as Chandy's maneuver. I have given the exact Mechanism of Chandy's maneuver in notes, you just see in the slide. But Chandy's maneuver is nothing but, this is also an MCQ question. So they may ask, Chandy's maneuver is done in which LMA? So you have to, the answer is LMA, intubating LMA or fast track LMA. So there are two steps. After inserting the LMA, first you tilt the LMA side by side and then you tilt the LMA up and down so that the correct position is obtained. Then you see whether the LMA is in position. After that you insert the endotracheal tube. This is the thing. This is called as Chandy's maneuver. Nothing else. You just remember the Chandy's maneuver name. This can be asked as an MCQ. Now this is called as C-track. So C-track is nothing but, this is also an intubating LMA, but only difference is we have a video camera attached to it. So that is called as C-track. Fast track is intubating LMA without a video. C-track is intubating LMA along with a small monitor attached with the LMA itself. Now this is called as ProSeal LMA. So ProSeal LMA is a very famous LMA. Almost many hospitals and many anesthetists are very fond of this LMA for two reasons. This is a second generation LMA. So in the previous class itself, in the classification we saw second generation LMAs are nothing but when they have an additional port for gastric desufflation. So here you can see that there are two tubes. So one tube is for the lungs and one tube is for the stomach. So you can see this tube continues in the backside of the pharyngeal mask, and here you can see the opening of this tube. So through this tube we can insert a Ryle's tube so that the stomach can be decompressed. There won't be any leak. And the another advantage is this tube has a bite block attached to it, so the patient cannot bite this. And the another advantage is this tube is an armored tube, that is, it has an inner lining of metal inside it, and it can be flexible. So it has multiple advantages. That is why many anesthetists are so fond of this LMA. On top of all these advantages, we got one more advantage, that is the leak pressure of this LMA is much more higher. So we know the leak, because of the low leak pressure only, we cannot give positive pressure ventilation to the patients with LMA. But here the leak pressure is higher. So this LMA was introduced. They told this is almost like an endotracheal tube. You can even ventilate this patient with this LMA. So this is the advantage. This is called as ProSeal LMA. So I told you know the leak pressure and sealing pressure is much better in this. So that is the name, ProSeal. Pro means better seal. So better seal. So this LMA is very costly. In 2016 itself, this LMA cost around 20,000 per piece. So this is very costly. So it can be used multiple times. So I told you multiple information with this LMA. I will repeat it. So it is a second generation LMA. It consists of two tubes, one for the lungs and one for the gastric desufflation. And through this gastric tube you can insert a Ryle's tube. And the tracheal tube, you have a bite block here. You have it is flexible and it is armored, and it has a high sealing pressure. That is why it is called as ProSeal LMA. Now whatever I told you, we are going to see repeat in the slide. So it is defined for three refinements in the mind. One is to improve the performance during control ventilation. We know that. Safety regarding aspiration. We know that. Ability to diagnose the misplacement of the tip of the device. So if the tip of the device is not placed properly, you cannot pass the Ryle's tube inside. That is how you find out. Now this tube is again introduced by the great Dr. Archie Brain in 2000. So the initially this LMA was introduced in 1998. That was LMA Classic. So first he was the one to find it. Then in 2000 he found out ProSeal LMA. So ProSeal LMA, you may get a question, and has two separate tubes effectively separating GA and respiratory tract. We know that. Three-dimensional cuff. One thing I forgot to tell you, this ProSeal LMA has a three-dimensional cuff. That is, the cuff is not only in the front, in the back also there is a cuff. So there it gives a much better sealing pressure and much better leak pressure. So that is why it is used for positive pressure ventilation also. And we have a drainage tube. The PLMA tube is also flexible. We know that. It is wire reinforced. We know that. It has a built-in bite block. That also we know that. I gave you all the information. You just go back and see. It has a better sealing pressure, better leak pressure. That is, leak pressure is around 25 to 30. Now again the same thing, it is repeated in the slide. We don't need to see this again. Now I have a question. So in the previous slide I written it has an introducer. So when you see this picture, you may think it comes with a handle. It comes with a metal handle, and this color you will identify it as a intubating LMA. But please don't do that mistake. See, you can. This is a wire reinforced tube, and this is nothing but an introducer. So this LMA can be easily inserted not only by your fingers, but it can be introduced by a introducer. So if it is given along with introducer, you just see whether how many ports are there, one port or two ports, and whether the introducer is attached to the LMA or not. So everything you see, and then finally decide whether it is intubating LMA or ProSeal LMA. So here you can see the cuff on the back side also. So it is a three-dimensional cuff. Cuff is on the front also, cuff is on the back also. The gastric desufflation port won't be present in intubating LMA. In ProSeal LMA only it will be found. For your convenience, I have shown the intubating LMA also in the slide. So here you see this is also everything is in the same color. But in ProSeal LMA we have two tubes. One tube is armored, another tube is gastric desufflation port. And this introducer is not completely attached to the LMA. So that is how you differentiate intubating LMA and ProSeal LMA. When it is given along with the introducer, it may look same. So you have to be very careful. So you might identify it as an LMA, but still you would have got the question wrong. So you should be very careful. So don't miss out on any questions. Now this is actual patient who has been intubated with a ProSeal LMA. So through this gastric desufflation port, we have inserted a Riles tube. Can you see it? So this is through this tracheal tube, we are ventilating the patient. Through the gastric decompression port, we are inserted a Riles tube. So this is very advantageous. Now coming on to newer versions, LMA Supreme. So you just see there are two ports. So it is a second generation. One is for gastric decompression, one is for trachea, and it is a much bigger cuff. So it gives a much better seal. It is almost equivalent to ProSeal. That is what they demand. This is LMA Supreme. You just remember this picture. You should not confuse this one along with LMA Unique. LMA Unique is PVC material of LMA Classic. But this LMA is the second generation LMA, which is different. So it is also a single use LMA, and it has a large inflatable plastic cuff, but no posterior cuff. So it has only a plastic cuff, no posterior cuff as that of ProSeal LMA, and esophageal drain is present. It is semi-rigid, and epiglottis is kept away from the LMA by a cuff. Now this is SLIPA. You can identify, this is a very peculiar structure. Now you can identify, you just remember when you see this image, you mark it as SLIPA. That is streamlined liner of pharyngeal airway, SLIPA. So here this is a second generation LMA. So it is cuffless, and here you can see an anterior opening. Here it is like the shape itself is exactly as that of the pharynx. That is the concept. So that is how it gives a seal, and it is said to be much better, but I have never used it because I have never seen it. So it is a cuffless plastic and disposable. So lines the pharynx, exactly the shape of the pharynx. So the tip is at the esophagus. So this anterior portion, the posterior portion lines the posterior portion lines the pharynx, and the lateral portion lines in the pyriform fossa. So this you just remember this peculiar image. This is SLIPA. Even if you don't remember the full form, nothing to worry, SLIPA. Or you can remember it looks like a slipper, because funny mnemonics makes us remember things. So as much as possible, keep funny mnemonics. Now this is AMBO LMA. So this is a preformed bent. So this is an LMA which is very popular in anesthetic use, because it is very easy to insert. No need to extend the head. You can just insert it like this. Because of the preformed shape, it goes and fits very easily. So it is also made up of PVC. It can be used multiple times. So it is a sterile disposable product, but actually we use for multiple times. You remember disposable, and built-in curve is there. So it is very useful. Now this is iGel. This is one other LMA like ProSeal, which has a very good recognition among the doctors, among anesthetists, because of its easy use. So this is iGel. So this material is made up of a gel which expands when it exposed to the body heat. So when you insert it inside the body, normal room temperature is 24 degrees. When you insert it into the body, it is around 37 to 38 degrees by Celsius, our body temperature. So because of that heat, this gel will expand and it will cause a very good seal around the larynx. So this LMA is very useful and it is highly preferred by anesthetists, including me. So the thing is, it is single use, cuffless. It has an integral gastric channel. You can see in the LMA in the previous slide, it has an integral gastric decompression port and epiglottis blocking ridge. On the upper surface of the cuff, on the upper surface of the laryngeal mask, we have epiglottis blocking ridge. And it has a built-in bite block. It is very thick and anatomically shaped bowl. So this comes in multiple sizes, 3, 4, 5, 6 and 7 and 8 respectively. Now we are coming to the end of the class. So laryngeal tube airway. So this they have asked in the previous NEETPG exams, NEET and other specialty exams. So here it is a first generation device. The concept here is we have two cuff, one cuff for pharynx, one cuff for esophagus, and there will be airway ports in between these two cuffs. So in field, in untrained persons who have nothing, persons who know nothing about airway, when they find a patient who is not responding, not breathing, they can just put it inside the mouth however they want. They can just put it inside the mouth and they can insert it up to a certain mark. They can insert gas, insert air, some 50 to 100 ml of air. Both these cuff will inflate. This cuff will inflate and this will block the pharynx. This cuff will inflate and this will block the esophagus. So in between, there is no other go. When you push air, it has to go into the larynx. So this is very useful. This is laryngeal tube airway. It is a first generation device because it does not contain any gastric decompression port. We have another device. I will show you. So here the parts are marked. So here distal cuff, this is blocked, this enters esophagus, this is a blind cuff. This is the proximal cuff, stabilizes the seal the oropharynx. And here we got bilateral eyelets. So this helps in ventilation. Here two ventilation outlets are there. This is how it functions. This is laryngeal tube airway. We have another thing that is called as combi tube. So this is called as combi tube. Here we have two ports. This is a second generation thing. So there is a proximal opening for gastric lumen. See here we have a gastric lumen, we have a esophageal cuff. Here we have a pharyngeal cuff as well as we have ventilation ports. So this is a second generation device. Combi tube. It has two tubes and it has two cuffs. It has two ventilation ports. Everything is two tubes. That is why it is called as combi tube. Simply you just remember like this. It is not given like this in book. I am just saying it for you to remember. Now combi tube, it has two cuffs, two tubes. The size is 37 French and 41 French. So 37 French for females, 41 French for males. Now limitations is trauma and esophagus rupture and cost. It is also costly and it is also used in the field. So when most of the patients with head injury, they may bleed into the mouth and you won't know whether the bleeding is due to where the bleeding is coming from. So people are afraid to use this LMA. That is why it went out of practice mostly. Now finally Baska mask. This is also in the previous class we told you that it can be considered as a third generation LMA because it has multiple advantages, because it has a suction port for this cuff also. Normally what happens is after inserting the LMA, some secretions may get pooled in the surrounding areas of the cuff. For this also they found a remedy. So that is the Baska mask. So they have gastric decompression port, they have cuff decompression port, and they have a air port with bite block, and it is a third generation device. It is actually produced in India and it is marketed to be a best device. I have used only once. You just remember, so this head of the LMA, at some angle it may look like a snake. So Baska means snake. So that is how you remember Baska mask. So that is how you can easily identify it. Now similar, same thing. Proximal end loops, which helps in fixation. Non-inflatable cuff. It is here also the cuff is non-inflatable, and elbow connector is for suction. There is an inbuilt bite block. So all those things, whatever I told you in the previous slide. Now this is the last slide. We have come to the end of the class. So you have to identify each and every LMA. So this LMA, what is it? It has a preformed shape. It has a metal handle attached to it. So it is intubating LMA. So if it has a camera attached to it, that is called a C-track. If it does not have a camera and only this thing, intubating LMA or fast track. So this is a classic. It looks like a classic LMA, but it's completely white, right? So it is LMA unique, which is made up of PVC. This is a classic LMA. So this looks like a classic LMA and it made up of rubber material. So this and this C and D are classic LMA. So this thing, you see two ports are there. There is a small attachment to curve the mask and the head looks like a snake. It is called as Basca mask. A preformed curvature is there. There is a single tube and this mask is called as ambu LMA. And here also a preformed curvature, a large cuff is there and there are two tubes here. So it is a LMA Supreme. And this you can easily identify the gel like material in the front. So don't confuse between Basca mask and eye gel. So eye gel, we have a gel like material in the place of cuff which will expand to the temperature of the patient and engulf the larynx. So this is LMA, eye gel LMA. Here two tubes are there, one for esophagus, one for trachea, and we have a gastric decompression port, armored tube. So this is ProSeal LMA. So you just remember all these pictures, some salient points if you are able to remember, that is well and good.